The humble hydroxychloroquine is back in the headlines. The reason remains the same, the HCQ. Is it the silver bullet that everyone has been looking for? Does it work against the Wuhan virus? Months have passed, but we still don't have any answers to these questions. The world remains divided over HCQ. Two camps have emerged. The pro-HCQ camp that includes countries that are widely prescribing it, and the anti-HCQ camps, countries and world bodies that stopped using this drug. The reason why HCQ is so popular is because of its high-profile endorsers. Leaders like Donald Trump and Jair Bolsonaro, they're firmly in the pro-HCQ camp. But the drug is also controversial for exactly the same reason. The publicity around the drug spiked in May when US President Donald Trump revealed that he is taking it. But America's own drug regulator has advised against its use. The Trump administration is not convinced. Yesterday, an official defended the US president's endorsement of the drug, citing India as an example. Let me quote, "This has become a highly politicized issue, but India uses this widely for prophylaxis. There are a number of studies which point to this actually working." Well, it is true. HCQ is being used widely in India, both for the treatment of COVID-19 patients as well as preventive measures. But reports say that India is rethinking its policy. And this comes after the World Health Organization stopped an HCQ trial for a second time. Those flip-flops are legendary. They say the drug is not working in their own trials. So does HCQ work or not? Well, no one has a clear answer. The science still remains inconclusive on HCQ. Some studies say it works, others say the drug is ineffective, still others say it has serious side effects. The jury is still out, but the fact is that the world is gripped by two pandemics right now. One is the disease itself, and the other is the politics of the pandemic, and no one has found a cure to either. In case of HCQ, it is the politics that is driving the decision makers. Take the case of Brazil. President Jair Bolsonaro has recorded a video of himself taking a dose of HCQ. He followed Trump's stand, but he has been more irresponsible and dangerous than Trump. Since the outbreak in Brazil, Bolsonaro has attended rallies, broken rules of social distancing, and finally in June, he was ordered by a federal judge to wear a mask in public. The Brazilian president is a coronavirus denier. Even after being tested positive, he's downplayed the diagnosis. But just like Trump, Bolsonaro has been obsessed with HCQ. Earlier, the Brazilian president had admitted that he keeps a box of the drug, just in case his 93-year-old mother needs it. Now, it seems Bolsonaro may be using that supply, not because any scientist recommended it. The Brazilian president's vote of support for HCQ is based on anecdotal reports. Under Bolsonaro, decisions on the COVID-19 crisis have become measures of political loyalty. As the situation in Brazil worsened, Bolsonaro pushed the health ministry to encourage widespread use of HCQ and chloroquine. Even when a study in Brazil was halted after patients developed irregular heart rates, Brazil lost two health ministers over Bolsonaro's demands. One was fired in April, the other did not last even for a month in his job. Both were physicians. Now there's a third man, someone with no medical experience. He complied with the president's request and issued a guidance that encouraged doctors to prescribe HCQ. The coronavirus is a global public health crisis, but its response is strictly determined by the local factors. Leaders have clutched onto HCQ because it's cheap. That's one of the reasons. In India, a strip of 15 tablets can be bought for as little as 100 rupees. And this is the reason why HCQ is such a hit, because it is affordable. It can be administered to a large number of people. A silver bullet, one that the world is desperate for, but HCQ is not a silver bullet, not at least now. There are more than 200 trials underway around the world just to figure out if HCQ works or not, and doctors are worried about the potential side effects of the drug. So why are leaders like Trump and Bolsonaro endorsing it? Well, this is an attempt to build a narrative, one that portrays these leaders as saviors fighting an evil system. They're pushing the idea that a cure exists and works, something that people around the world are desperate for. But there are few who believe this line of argument so far. Doctors and scientists are clearly not among them.